Michelle Hawkins, and I'm a physical therapist with Franciscan Health. So what blood flow restriction is, it's using these cuffs that restrict but do not cut off blood flow to help the muscle work harder. And it helps by, when you reduce the blood flow to that muscle and then you exercise it, it builds strength in that muscle faster than if you were just doing light exercises without it. Using blood flow is different than just doing other exercises with the band because it really helps to build the strength and the bulk in the muscle as if you were doing high intensity strengthening. So to really build strength and muscle bulk, most people traditionally will do high intensity strengthening, which is like a lot of weight basically with exercises. In therapy, most of the people here, they have an injury or they've had surgery where they're just weaker and so they can't tolerate doing that heavy weight. So then we use the blood flow restriction and then do more of the therapeutic exercises that's lighter weight, more tolerable, it's easier on their body, and we can use resistance bands, but then with the blood flow cuff on there, it helps them to get the same results as if they were doing high intensity strengthening. If you're just coming out of surgery and you've lost muscle mass in your limb, either multiple limbs or just one, then we would use blood flow restriction to help build the strength and mass back up. This process works by, you can use it on one limb or multiple limbs, and we have these cuffs and you put it around either the very upper arm or the very upper thigh, and then we will pump it up to a certain pressure, and then once that is on, then you will go through your exercises with it on. What to expect during the process is you'll feel a lot of pressure through your limb. Maybe it might feel tingly just because we are restricting some of the blood flow. It might turn red or even purple. The next day after you've had a training session of blood flow restriction, you will likely feel sore. If the soreness lasts for multiple days, then that means it was maybe too intense and we will tame it back down. If you don't feel sore at all, then it wasn't intense enough, and so we will make it a little harder for you next time. The big benefit of blood flow restriction is building strength in a safe and effective way. In order to get set up for blood flow restriction training, you just get an order for physical therapy. We do have direct access, so you can come to physical therapy via direct access, or you can get a referral just for physical therapy for that treatment. It doesn't have to be specifically for blood flow restriction, just coming to physical therapy to have it done.